a good idea. Thank you.
And then also for media in the room and on the phone, and we will repeat this, and for our public expectation, we're going to do this today. We'll have press releases and information over the weekend unless there's breaking news that we would maybe do a conference. We will start a daily press briefing Monday through Friday on Monday. So today, take a break Saturday, Sunday. All of our operations are open. We will keep media informed, but unless there's breaking news, the next live press conference will be Monday.
Same time?
That's hopeful, so to be determined, but that's what we're going to aim for so that you all know same time, same place. So if this room works, we'll probably keep it here. He's trying to get audio. We're on standby for audio. This used to be on, and it's got it. Yeah, it's on that one.
We're good.
You want me to follow the people with this, and Chair Hardy's going to introduce you. I saw. I was reading his notes.
Mala. Mala.
Yes, sir. Let me say it fast. It sounds like Malta.
I could do it that way. Same.
I'm following whoever speaks as fast as I can. Some people notated that I was in the last one. Like, I got my jogging shoes on. I'm ready. No problem. Thanks for keeping me in track. People like that.
So you have callers on because you're in the conference call? Okay, let's test this. Why don't you open, make sure that everyone can hear okay. We've got a couple of phone in the room.
Okay. Welcome, everyone. I want to make sure that everyone can hear us before we begin. Do folks on the phone hear us? And it sounds like we are ready to go. So thank you all for being here. I am Greg Hart, Chair of the Santa Barbara County Board of Supervisors. I want to introduce our American Sign Language interpreter, Mala Poe, who is here from the Independent Living Resource Center. I want to also note that this press conference will be translated into Spanish and posted on all the county's websites and social media sites, so folks will have access to this in Spanish. I want to start off again by thanking all of the individuals who are working as part of the county team, all of the medical professionals in Santa Barbara County, and all of the service providers who are working diligently, long hours, to protect our community from the COVID-19 outbreak. There are a lot of folks who are dedicated to protecting the public health and safety of all the residents of Santa Barbara County, and it's very important that all of us remain calm and patient during this very difficult time. This is a new event in our lives, and this is a moment for us all to practice extra patience and empathy for those of us around us while practicing social distancing and healthy habits. This is a very important message. I want to make sure that everyone understands that very clearly. Our county has experienced emergencies in the past. We are a resilient community. We have weathered these events previously and come out stronger than ever, and we will do so in this circumstances as well. Last night, Governor Newsom issued a statewide stay-at-home order mandating that all Californians practice enhanced social distancing by staying at home. This is a very serious new event, and we want to emphasize how important that is. Our community has been practicing social distancing for about a week now, but this new order will help ensure that people stay home in an effort to prevent the spread of the virus. The health and resiliency of our community depends on every single resident taking the public health orders seriously. I know it can be difficult to make the significant adjustments in our daily lives that this is being asked of us, but we all must do our part in reducing the impact of COVID-19 on our community. I'd like to thank our public health department, the entire medical community, and our emergency management professionals for their tireless work to respond to COVID-19. Our nurses, doctors, and other medical providers are working long hours and performing heroic work on the front line of the response to COVID-19. Many people in Santa Barbara County are counting on critical services to be delivered, and I want to make sure that our hardworking county staff is available and ready to continue to protect the health and safety of our community and to serve those who are in need. The Board of Supervisors is continuing to meet to make sure that our local agencies have the resources that they need to respond to COVID-19. New technology is being used to allow for remote public participation in board meetings, and county officials are practicing social distancing in our workplace. Our dedicated first responders are continuing to respond to calls for service. Our Department of Social Services is continuing to address the immediate needs and service needs of our entire community. And our Housing and Community Development Department is working to ensure that services are in place for people who are experiencing homelessness during this public health emergency. These are just a few examples of the critical work that's being conducted by county staff members. The medical professionals that I have the privilege of joining this afternoon will provide the community the following updates: the current status of COVID-19 in our community, prevention and disease control efforts, local testing capabilities, medical supplies, emotional health, and other important topics. In closing, please remember to take the simple but important steps to protect the health and safety of your loved ones by regularly washing your hands, staying away from other people if you are sick, making sure that you are taking steps to maintain your personal mental wellness, contacting your medical provider or the Public Health Department's Community Health Division if you are feeling sick and need medical assistance. And lastly, and most importantly, please take seriously the orders from the Public Health Department. Complying with public health orders is necessary for protecting the health of your loved ones and our entire community. With that, I would like to introduce Dr. Vonde Reynoso, the Director of the Santa Barbara County Public Health Department. Dr. Reynoso.
Thank you, Supervisor Hart. Can you hear me? Update on cases. Effective as of today, as of this moment, we have 9 confirmed cases. Our Disease Control and Prevention Unit are working 24/7 to contain the spread through their case investigation and case tracing. Yesterday, we announced on a teleconference that we were going to issue a local health officer order to contain the spread of disease. Because it is essential to slow down the virus transmission as much as possible and to protect the most vulnerable members of our community and to prevent the healthcare system from being overwhelmed. We were about to do that. However, we were made aware of the impending executive order from the governor, so we deferred to his action. I want to just spend a little minute on what that means, the Governor Newsom's shelter in place or safer at home executive order means to us. It really means that we, as a member of, as community members, need to stay in our homes unless we are accessing essential services, such as pharmacies, grocery stores, and banks. Like the governor mentioned, people are still able to go outside. You're able still to go to the grocery store, walk your dog, as long as you practice social distancing and keep that 6 feet apart from people that you don't already live with. We strongly encourage every member of our community to abide by the order, so that we can, as a community, slow down the progression of COVID-19. With regards to the most vulnerable members of our community, people experiencing homeless, we are working with the Homeless Task Force to ensure that those who are currently in the shelter system are assessed for their health, and if they are presenting with symptoms, are taken care of. We also want to let you know about our website. You've heard me talk about that website, but I just can't stress that that is a great place to get current information, and that is publichealthsbc.org. Here you will get up-to-date key information from the federal government, from our state government, as well as our local health orders. Queremos informarles sobre nuestro sitio web, publichealthsbc.org. Puede obtener información importante sobre el COVID-19 aquí. And I'd like to end with a huge appreciation of all the support that we are getting from our community. We've heard from our education partners, we've heard from our healthcare partners, from our philanthropic partners, and as Supervisor Hart said, together we will overcome this and we will come out the other side stronger as a community. Thank you.
Thank you, Dr. Del Reynoso. I just want to remind folks who are on the telephones to please mute their phones. We're getting a little feedback. Thank you. Go ahead.
And with that, I'd like to introduce Dr. Ansorg, our health officer.
Thank you, Director Del Reynoso. Our recent increase in cases and the widespread over the county has shown that we now have widespread community transmission. This means that we can no longer hope that Santa Barbara area will be spared by this virus. The only option we have to slow down the spread of the virus is really social distancing, aside from practicing good hand hygiene and the like. Social distancing is really the only option we have in order to slow down the progression of this contagion. This virus is very contagious, and nobody has any immunity to it because it is a very new virus to the human genome. I would, in particular, urge our younger population to take this seriously. I've seen pictures from beach parties and so forth, sometimes called COVID parties. I strongly advise against any of this. Unfortunately, this virus is quite capable of making even younger and healthier people quite ill. Obviously, the odds are in their favor. However, it is not unreasonable to believe that a younger person can get seriously ill. Social distancing seems to be a very crude and primitive measure at a time where we rely on fancy medications and fancy tests. But unfortunately, this is really our only measure that can help us slow down the really rapid progression of the virus. If we were to let the virus run its course, we would end up worse than Italy, meaning 80% of the population, closer to 85%, would get sick within 2 months. And at least 5% of that, or maybe even more, would need to be hospitalized in a time frame of 2 months. This would mean that our healthcare system would basically collapse. In order to prevent this from happening, we have to take social distancing really seriously. This will give us the chance that not as many people get sick at the same time. I urge everybody that even if you only have mild symptoms, to please take the self-isolation to another level. Consider yourself sick, even if you do not have a test result. Please stay by yourself and for at least 7 days. We consider somebody no longer contagious if at least 7 days have passed from their onset of symptoms, and if 72 hours have passed since they did not have a fever anymore without taking medications to lower fevers, or if their upper respiratory symptoms have almost resolved. Thank you.
Thank you, Dr. Ansor. Next, I'd like to introduce you to Dr. Comer from our Public Health Lab, and he will be giving updates on testing.
Thank you, Director. So the main changes that have occurred in the last 24 hours are very, very promising. Just so you know, if you look at how many tests we did the entire month of February, it was done pretty much by CDC and a few public health laboratories, state laboratories. We now have brought on capacity as of today. One of the largest national laboratories just opened up in Phoenix, testing that will provide 10,000 tests a day, and we did probably 1,200 tests in the entire month of February. So that's extremely promising for this. It's just now we have to catch up with literally the tens of thousands of specimens. So the turnaround time for the patients that we've submitted will start to decrease, and that has been the biggest issue. So that's extremely important. Another important announcement that came out today is they will also allow the collection kits to be saline swabs and not the actual collection kits we currently use. So that has been validated at the national laboratories. So this now allows us to open up the possibilities of being able to test more patients once this system goes into place, and it should be relatively easy now to get those supplies as compared to the current shortages that we have. So both of those are extremely important. I just want to reiterate what Dr. Ansorg and the director have said. There's been tremendous collaboration between the hospitals and all of the private healthcare systems in Santa Barbara County in order to accomplish what we have, and people are working extraordinarily hard and long to make this happen. And I think we're starting to have positive benefits in our direction. So thank you very much for your patience.
Thank you, Dr. Comer. Next, I'd like to introduce you to Jan Kogler, our Emergency Preparedness Program Manager.
Thank you, Vaughn. I'm going to speak a little bit about scarce medical resources and the personal protective equipment that is used by healthcare providers to protect themselves from the virus. And as you may know, that includes a mask, either a procedure mask or an N95 mask, goggles, gloves, and a gown. And all of our healthcare providers are reporting shortages with those items. We have been able to help them through our disaster cache here with N95 masks and some amount of the other items that they need. But we are all seeing lowered levels of most items, except that we do have a good supply now here in our county of N95 masks. And depending on the amount of patients and what surge we have to our healthcare providers, we could probably at least get through the next month. We've also requested items from the Strategic National Stockpile, and we expect those to come in, which will help us. And then Direct Relief has also assisted us with supplies, and we're getting those out to our healthcare providers who are requesting them from us. So I know there's been quite a bit of concern, and we are working together through a scarce medical resource group, which includes providers from across the county, to determine what are we going to do when we do run out of certain items and what are substitutes. And the CDC is guiding us on that, but certainly we are all concerned about the low levels of some of the items needed to protect healthcare workers.
I'd next like to introduce Suzanne Grimacy from the Department of Behavioral Wellness.
Thank you, Supervisor. We are again finding ourselves in uncharted territory. As the exact threats that the coronavirus has placed on our community are unknown, our minds can easily overestimate these and underestimate our ability to cope, creating much stress, anxiety, and worry. However, how we cope with a situation like this is not new to us. We have been here before. We know how to adapt quickly, and we know how to learn to do things differently to keep our community safe and connected, and we will make it through this challenge as well. Perhaps COVID-19 is challenging us with a time to reset, to remember what is most important, to connect us in a new way with family and community, more time at home with family and loved ones, to outreach to others who are home alone or need extra support, to get outside more, to look around, to enjoy nature, to exercise outdoors, to take walks, to walk dogs more often, time to catch up on nagging home projects. There's a lot of positive that we can see within this. To realize that we can still and must keep our connections with others stronger now than ever. Social distancing and sheltering at home do not mean social isolation, and perhaps it will help us to reconnect with what matters most, to reset, to gain new perspectives. We must still continue to make connections as a community and as individuals and find new and creative ways to make this happen. My personal new favorite is Zoom. My teenage daughter sits with her phone constantly on. She draws art with her friends. She watches TV. I think the creativity to this is endless. In closing, the Community Wellness Team is still here for our community and has resources developed to meet the needs of COVID-19, which can be accessed virtually and accessed countywide. To be connected with support resources available through the Community Wellness Team or just someone to talk to, please call 805-364-2750. Thank you.
Thank you, Ms. Grimacy. Next, we'll take questions from folks in the room here. Who would like to begin?
I have a question. I'm Jason with KSBY, and the 9 people who are have the disease, how are they doing, and talk about their recovery efforts.
I'll repeat the question so that the folks on the phone can hear it. Jason from KSBY TV asked, of the 9 patients who have been tested positive for COVID-19, what is their prognosis? How are they doing? How are they faring with the outbreak?
Well, I'm happy to report that none of those cases had to be hospitalized. They are all well into recovery.
Thank you for that news, Dr. Hansford. Ryan?
How many, what's the number right now in terms of cases being monitored for potential testing?
Ryan from KEYT TV asked, what are the number of cases that are being monitored right now?
We are currently awaiting about 200 test results. There's a caveat, though. Some tests that were ordered by providers to outside labs that we do not know about. So it's possible that there are more test results in the pipeline.
A lot of people are still going out and doing their normal things. How do you talk to those people and tell them that they really need to take it seriously?
Jason asked, a lot of people are still going about their daily activities and so far have not taken this public health order seriously. What are we doing to convince them that this is a serious threat? First answer is we are here communicating this message to the public. We want everyone to take this seriously, regardless of their age or their health conditions. This is the most serious threat that we have faced as a community probably in our lifetimes, and it's extremely important for people to take this message seriously. That cannot be overstated, cannot be repeated often enough. This is a significant health emergency, and we urge everyone to comply with the public health order. Yes, Ryan.
Kind of going off of that, as recently as last night and even today, we've seen people dining inside restaurants or on patios at restaurants that are supposed to be only takeout or delivery at this point. Is the county planning on strictly enforcing that with restaurants in the county, and if so, how?
Ryan asked the question that there continue to be people dining in restaurants. Is the county taking efforts to enforce the public health order to assure that that does not continue? Who would like to answer that question? Dr.
That
Dorinessa?
is really unfortunate, and I'm really hoping that with the social messaging of our governor's executive order and like what Supervisor Hart just mentioned, I'm really hoping that we as a community can abide by the executive order. With regards to restaurants, our environmental health services team will be reaching out to all the food places to really work with them on removing the dine-in option and to quickly transition to a dine-out option.
There's a lot of people that are really panicked about this, running in the stores, doing weird stuff. What do you say to them?
Jason asked the question. There are a lot of people who are panicked, who are hoarding items from the store, shopping, and rushing about. What can we do to tell them? And I think the answer to them is please do not panic. Prepare and be methodical about your approach to this. Take the public health order seriously and avoid being in public situations, but you still have access to food and groceries and can begin to access your medical providers, the pharmacies. All those things are still available. There is no reason for people to panic and to not comply with the order. Yes, Ryan.
Yesterday we saw San Luis Obispo County put in a countywide shelter at home for all residents. Then, of course, Governor Newsom had that statewide order. You had a health officer order announced yesterday that was to go into effect today, but it was not quite to that same level, asking all residents to shelter at home, just the more elderly, more at risk. So why was that the decision from your perspective rather than a more strict order?
Ryan asked the question about the pacing of the public health orders coming from Santa Barbara County in comparison to San Luis Obispo County, the extent of the order, and then in relation to the governor's action later yesterday evening that expanded the order statewide to cover all people. I think, Dr. Dorinessa, do you want to? Or is
Dr.
Answorth?
Yeah, I'm happy to respond. We do take curtailing personal liberties, seriously. We do not take that lightly. And we need evidence to back us up. And we need evidence that shows that whatever measure we implement has the best effect with the least harm. So as of yesterday morning, especially myself, felt that the next step would have been to just isolate the ones most at risk, and knowing quite well that this was going to be an increment in, towards the eventual necessity of a more general order, basically to limit people from going out. And Governor Newsom, he beat us to the punch, basically, by a day. Or two. And, the state is large. It has very different communities, and every community has a little bit of a different makeup of, urban centers and rural areas and so forth, and Santa Barbara is a little bit in the middle there. So I agree with Governor Newsom, and I just urge everybody to comply.
the same type of efforts that China did to kind of make the numbers start to go down?
Jason asked the question, are we doing the same interventions that China did to get the numbers to go down?
Well, China is not as much a democracy as the United States, as we all know. So they really implemented martial law, so to speak. And they were not quite as sensitive to the personal liberties as we want to be. That is just one of our values in this country, and we want to keep that a sacred value.
Yes. Could you state your name?
Daniel from Santa Barbara Independent.
Thank you.
I guess this is more for Greg. Is the city in plans to help local businesses after this is all over? What about the food service workers that have been laid off? People that aren't able to pay rent, work, all those things that people are also worried about, sitting at home. How does the city coming up with a plan here?
Daniel from the Santa Barbara Independent asked, there's going to be significant economic impact from this event. Does the county have plans to assist food service workers, individuals who are struggling with rent payments, dealing with the economic impacts of this outbreak? The county is working in collaboration with all of the levels of government in our community, the city governments, the state governments, and the federal governments. The federal government is working aggressively to provide assistance packages to individuals and to businesses. There are more of those packages that are coming to the local communities. The state is doing the same thing, and the county is also preparing for economic recovery and assistance to local residents. Are there any other questions from the folks in the room? All right, we'll next go to the folks on the phone. If you have muted your phone, please remember to unmute. I believe caller 6 is on the line and needs to unmute their phone. Star 6 to unmute your phone. So is there anyone who's on the phone that would like to ask a question? Please just go ahead. All right, well, thank you very much for participating today. Are there any additional questions from folks in the room at this point? Yes, Ryan.
There's a lot of complicated issues that social distancing now and the stay-at-home order will now represent that will, I'm sure, come up in the next couple of weeks. One that I know I've gotten people asking about are parents with split custody and children going back and forth between homes. Is there any kind of guidance or thought about where those children should be most of the time? Should they be with the parent they are already spending more time with? What if one of the parents is staying at home and another is working in an essential field, mitigating the risk there? So is there kind of any thought when it comes to child custody?
Ryan asked the question. There are a lot of complicated issues with different family structures, children who have joint custody with different parents. What is the recommendation? What is the best practice for folks in a situation like that? Suzanne, do you have any thoughts?
Not from a medical perspective, I don't, but I can say from an emotional perspective, I can see how this can create a heightened amount of anxiety and worry for families. So I think the guidelines that we've been hearing to practice with each family, the social distancing, washing your hands, and should the worries raise with the child, I think talk directly to children, enforcing the same guidelines, assuring that the parents are taking care of them. Stay informed to information that's out and about. I think that's what we can do.
And I think that's a great final word. Ultimately, we all have to cooperate. We all have to work together. This is the moment for us to rise to our best condition and to work together as a community, to do all of the things that we've been asking, to comply with the social orders, to be a friend and a neighbor to your community members. And we will persevere and prevail through this difficult moment. And thank you all for your cooperation. We are done today. And if folks would like additional information, please go to publichealthsbc.org, publichealthsbc.org, or call. The call center is also staffed and available at 833-688-5551, 833-688-5551. And if you'd like to watch a rebroadcast of this press conference, you can go to the YouTube channel at CSB TV 20 or the county's public websites or social media accesses. And 211 is also available for additional information. Thank you all for your attention today.
All right, good evening, everybody. Thanks so much for joining us at the just 4 minutes past the 5 o'clock hour. I want to thank Santa Barbara County Public Health holding their third public press conference updating the community on the COVID-19 situation. We have learned there are now 9 confirmed cases in Santa Barbara County. 200 tests are pending, waiting for results on those. Of the 9 cases, though, no hospitalization for any of the patients. All are in recovery, so this is great news. Dr. Henning Ansorg, though, did have a very somber tone, stressing the importance of social distancing, saying that is the only option to stop the spread of this virus, to slow it down. No one has an immunity against it. It is new to the human genome. This is really important to grab and to grasp and to understand. Also calling out young kids and young adults having what they call corona or COVID-19 parties, strongly advising against that because he's seeing more and more throughout the world, seeing more and more young people becoming ill. Another important point to make that new online is a testing lab in Phoenix, capable of doing 10,000 tests a day. This is huge. In the month of March alone, apparently, or the month span between February and March, 1,200 tests were confirmed and not confirmed. Sorry, were done. So this is a big number, a difference that's going to really help once the whole system is in place. That also includes a collection kit with saline swabs. They're working to get that in place as well. And Suzanne Grimacy saying really use this challenge that we're facing as a community to really cherish the time that we have with family, spending more time connecting at home with family, getting projects done, getting out walking the dog, enjoying the outdoors. So again, want to just share that crucial website for folks who want to look at the updated information, Public Health, SBC.org, and we'll have that on our website as well. And 9 in Santa Barbara County. We learned earlier today 16 confirmed cases of COVID-19 in San Luis Obispo County. They had their press release just over an hour ago. I want to check in now with Dave Alley, and he's got the very latest from San Luis Obispo County with those newly released numbers there. Dave?